in a free and fair debate.
I call the honourable member for Indi.
Thank you, Madam Speaker. My question is to the Minister for Social Services, and it concerns support for aged care residents in rural communities. From the 1st of July 2014, a higher accommodation supplement will be paid for supported accommodation, provided the service is newly built, has met the criteria for refurbishment and a supported residence ratio of 40%. Minister, can you please tell the House what arrangements are in place where population density prevents providers, such as Glenview Community Service in Rutherglen, from meeting the 40% ratio?
I call the honourable Minister for Social Services.
Thank you, Madam Speaker, and I thank the member for Indi for her question. Indeed, being a frequent visitor to the seat of Indi, I was there in Mansfield over the weekend, and can I say, having grown up in rural Victoria and having family in rural Victoria, I share her concerns about the plight of residents, and particularly the aged residents of rural parts of Australia. To come to a question, it's true that the government pays an accommodation supplement to assist low-wealth residents who can't meet the normal cost of aged care. And in order to encourage aged care providers to take in more low-wealth residents into their homes, then it pays that supplement where, as you pointed out, the member for Indi, 40% of the residents are of low wealth, as defined by the legislation and the regulations. In those situations which you allude to, the member for Indi alludes to, where less than 40% of the residents of a particular aged care home are deemed to be low-wealth individuals, that in those circumstances, rather than the 100% of the aged care supplement being paid, 75% of the aged care supplement is paid. And as I understand from the latest data, that amounts to that 75% amounts to about $25 per person per day. So, in addition to the other payments which are received by the aged care provider, where less than 40% of the residents are deemed to be low-wealth individuals, then a payment of approximately $25 per person per day is paid. Now, it's true that there are some further changes coming in from July 1 which reflect upgrading of particular residential accommodation in various parts of Australia. Can I simply add to what I've explained by way in which the system works, is that the government has asked the the Aged Care Financial Authority to advise us on the support of low-wealth individuals, not only in rural areas of Australia but indeed right across Australia, in terms of their accommodation in aged care. And finally, we're also examining the needs of rural aged care services in relation to the election commitment we made to repurpose the aged care workforce supplement, and the government has that matter under consideration at the present time. But I can advise the member for Indi, and indeed all other representatives of rural and regional parts of Australia, that is under active consideration at the present time. And finally, as the member for Indi raised matters concerning her electorate, I'm not sure if she knows, but the Deputy Prime Minister recently approved a community development grant for the Bright Hospital to look at the feasibility of the redevelopment of that hospital.
Minister's time.